And welcome everyone to the Real Leaders Podcast with Keys from Keynotes here at the Agents of Change Summit. I'm your host, Kevin Edwards. Joining me today is LeShaundra Cordier, the Associate Director for the CDC. LeShaundra, thanks for being with us today.
Thank you for having me.
So the opioid epidemic, big talk about this conference going on today. To you, what is the current state of the opioid crisis?
So that's a pretty loaded question. It's actually really complex. So the current state of the crisis is that it's evolving. We've started doing work in this many years ago when we realized that there was a prescription opioid epidemic issue, and overdoses were kind of hitting a peak around that particular drug category. And now we're seeing the evolution of that from heroin and psychostimulants and substances of that nature moving into other illicits. So there's a lot more happening in the drug landscape that makes the epidemic a little bit more complex. And so we're seeing it evolve and change. And the current state is that it's getting better on some fronts, but it's actually kind of getting worse in other areas, and we're monitoring those as we move forward.
So let's focus just right now on the typical person who gets a surgery and gets prescribed oxycodone and then resorts to heroin or fentanyl after that. What is the CDC doing in terms of working with big pharmaceuticals and prescriptions?
Right, so in that scenario, what we've kind of focused our work in is educating providers and educating clinicians and also educating patients, because if you're prescribed an opioid by your provider, we want to make sure that it's necessary, that they're operating under best prescribing practices and following our CDC guideline for prescribing, and then also that you're aware of what your options are for non-opioid pain management and that you have the most effective and safe care possible. So for us, we're attacking that issue across the board, looking at the whole spectrum of care and making sure we're helping everybody in that space. So a lot of our work is kind of centered there. Working with providers is what CDC is really known for. We're also working with state health departments and others to help spread the message across the country to make sure we're helping prevent in an upstream way some of the addiction and other things that we're seeing.
So when you say in an upstream way, maybe explain to our audience who are listening to this for the first time what you mean by that.
Sure. So thinking about primary prevention, we really want to focus on a couple of key things: stopping initiation of opioids and exposure to opioids for people who don't need it. Also working with our states and our locals to make sure that people have the resources and the tools that they need to be able to not have to use opioids to manage their pain. And then again, educating providers. We do training and other clinical resource tools. We have a mobile app available to providers that talks about opioid prescribing and how the best ways for you to be able to do that. And so a lot of what we've been doing in that way is kind of the prevention component and then working into the treatment recovery and other pieces that come after.
Okay, so LeShaundra, you work for the CDC.
I do.
Is addiction a disease?
Yes, and CDC is just one agency in the federal landscape that helps kind of work with addiction, but we like to look at addiction as a disease. It's a treatable and preventable disorder, but it's something that is important for people to recognize that it can impact anybody, just like a disease can. It can have the same effects and outcomes that any disease can, and it can be treated like a disease. And I think one of the great lines that we like to talk about is that it's a disease and not a moral failing. It's important, especially with stigma is concerned, that people understand that it, like diabetes or heart disease, that there are things that happen in your world and in your life that can result in addiction, and there are things that we can do on the healthcare side to help prevent.
So we've been throwing around this continuum of care, pre-exposure, exposure, addiction, withdrawal, in recovery, out of recovery. So maybe help our audience understand how someone can be cured throughout that process. If you're saying it's something that can be cured, I guess. Is that a good question? Kind
of, and I wouldn't say that addiction is something that can be cured, because people who are struggling with addiction can do that for the rest of their life.
Right.
So I don't want to say that, but I think it's important that the continuum of care is really explained as the various intersections that you have to get from start to treatment, right? So from the start of your issue or your concern, whether that might be an injury or a surgery or something that might expose you to chronic pain, to how you're handled in the healthcare system, to how you're handled outside of the healthcare system, to the work that you might have to do as an individual to help with your own recovery. So I think there's, we talk about spectrum of care. We also talk about the whole healthcare system and the whole healthcare model, and thinking of people besides just your doctor, whether that's working with social workers or working with mental health professionals or working with family and counselors. There's a lot of people that you might work with with
Right.
in the continuum of care. That's important to kind of think about besides just your doctor, your primary care provider.
I'm glad you drew that distinction in terms of the cure as well. I totally agree with you on that. It cannot be. It's something that people deal with their entire lives, like you said. So I guess the question I have for you is, like, the average prescription is 7 to 13 seconds. Like, a doctor will prescribe you something. Like, what's really changing in this space, and maybe what excites you about the work that the CDC is doing?
So in terms of changing provider practice,
Yeah.
that's actually kind of what we've worked hard to do.
Right.
And so, part of that is making sure doctors know that they are part of the problem and the solution.
Totally. Yeah.
Right, and also working with them within their own space and the things that they're doing to make sure that they have the tools that they need to make those kinds of decisions at the point of care. I think the thing that excites me most about this work is the communications aspect of it. Getting to share the message and develop the kinds of messages around opioid overdose prevention are really thrilling, and they're exciting. And I think just watching how the conversation has changed and how the narratives have changed when I first started this work in 2015 to where we are now, and being a part of that has been amazing. And I think for us, at least in the communications landscape, the big issues for focus that we've been focused on are stigma and helping reduce that and having an impact in the narrative that's being told, and also helping with others understand what the opioid epidemic really is, the overdose crisis really is, and then how that applies to not just the work we do in this substance, but with others. So polysubstance use and multiple, exposure to different drugs besides opioids, all of it can relate back to how we message around opioids, and that's critical.
Okay, so this narrative, this message. I asked you what excites you the most. Now I'm going to ask you what terrifies you the most.
What terrifies me the most? I think that's also it's a gift and a curse, right? I think the stigma inside and seeing how people are treated, and how the challenges and barriers they face to getting care and getting access to care, that's something that scares me quite a bit. I think while we are seeing a lot of hope in how things are changing, we're seeing declines in some of the drug overdose numbers that we're starting to see out of this. We just most recently released some data. We're starting to see we're having an impact, which is great. But I think what's scary is that it's a shift to different types of drugs. There's a shift into things like methamphetamines, and we're seeing shifts with heroin, cocaine, and other substances, marijuana. So I think recognizing how much this crisis can evolve is kind of scary. But I'm happy and confident and relieved by the fact that folks like CDC and other federal agencies are trying to make a difference there.
CDC, yourself, taking on something that is scary, that is a big problem, it's robust, and there's not a one-size-fits-all solution. We consider that some pretty bold leadership. So the last question I have for you today, LeShaundra, is what is your definition of a real leader?
Of a real leader? I think my definition of a real leader, and I hope a good leader, is innovating and integrating and collaborating for the greater good. It's helping achieve those outcomes that are sustainable and optimal for everyone, and doing that by, collaborating with others, doing that by paving the way and leading the way and how we model the way, right? And then really integrating that fully and sharing that knowledge with others and helping spread that word, right?
Had a pleasure speaking with you today. Talked about a lot, talked about CDC's involvement in the opioid epidemic, talked all the way about the continuum of care and kind of where you see your role in that, as well as spreading the narrative as well when in the CDC's involvement and taking on something that's pretty challenging to do. So LeShaundra, just want to appreciate you coming on the show today, the Real Leaders Podcast. For everyone listening out there, go out there, make sure that you can collaborate for the greater good, and always, folks, keep it real. Thanks, LeShaundra.
Thank you. Thanks for having me.